Hello, my name is NJaeger, and I will be presenting um, a PowerPoint presentation on concepts and theory using interpersonal relationships and for opioid use disorder treatment. During this presentation, I'll be talking about Hildegard Peplau's theory of interpersonal relationships, the Healthy People 2030 initiative, my project question, and how the initiative and the theory apply to my project. So Hildegard Peplau looked at four major areas with regard to treatment and interpersonal relationships. The first one was the person, the client, the patient. She believed that patients were always seeking equilibrium within their lifespan, that they did this to reduce the number of anxiety and stressors that come with just living life in general. And she also looked at the opposite of that, that patients were always in a state of unstable equilibrium as it fluctuates day to day and year to year. That the needs they have at one stage of their life is not the same as a different stage of their life. She also felt that there was no fixed environment for the patient, that the environment of the patient will fluctuate just as often as their needs do. She also didn't look at their overall health solely with the physical health. She felt that the human condition was always seeking a way to move toward higher productivity, higher creativity, working at a better place within their community, their personal outlook as the patient defined what was important to them. And then she also felt the nursing had a special place with regard to patients, that they had a key role and responsibility for creating the therapeutic interpersonal relationship that they cared for. In this case, the advanced practice nurse. This relationship functions cooperatively for the best outcomes, and that she felt that the nurse should have strong problem-solving skills to help them advocate for the patient's overall needs. She also felt that the patients had to pass through three stages during their treatment process. The first one being orientation, where the patient has to come to terms with their diagnosis and the circumstances related to their health. The second part, which was the working phase, was where the advanced practice nurse would spend most of their time assessing, treating, teaching, reassessing, and creating the multidisciplinary team that might be needed for the patient to improve their situation. And then the termination phase, where the client would take the accountability and responsibility for the management of their disease process after the primary treatment has been provided. Healthy People 2030 is an initiative in the United States that really speaks to 5 areas: the health conditions, the health behaviors, the populations they serve, the settings and systems, and the social determinants of health. And treatment for patients for opioid use disorder falls primarily within the health behavior categories with this initiative. Keep in mind that social determinants also play a factor within the specific population with regard to their access to care and treatment. Health behaviors with regard to the overall goal of 2030 was to reduce the misuse of drugs and alcohol within the treatment settings and outside of the treatment setting. So currently there has been some improvement specifically to heroin use, but it is reported that there has been little to no improvement with the misuse of opioid prescription medications. And additionally, drug overdoses and the number of people reporting what they use has been increasing. And the number of persons seeking treatment for opioid use disorder has not changed significantly. In the past, their focus was primarily only on heroin, but now we have an introduction of semi-synthetic opioids and has created a worse problem within the United States. Social determinants: many patients don't have health insurance or have coverage for treatment of substance use disorder unless they're admitted emergently into the hospital, which is the most costly level of care for the patient and could create a significant financial burden for them for treatment. Stability of a patient is directly tied to accessing their care that they need to reduce their risks related to misuse or addiction to opioids and the overdoses that may occur from it. Additionally, decreasing the number of overdoses with the proper treatment referrals could impact the emergent treatment costs and the deaths related to overdose in the society as a whole. So my clinical scholarly project is based upon using a validated tool called the NRI Subjective Quality of Life Mental Health for Addiction. Patients who choose to participate will have an initial baseline and an additional one at 90 days after they start buprenorphine medication-assisted therapy. And the goal is really to determine if quality of life can make a difference, or improvement in quality of life can make a difference for patients who may be on the fence about seeking treatment for their opioid use disorder and could possibly be a motivator for continued sobriety after the fact. How does Peplau's theory mesh into this? Well, Peplau was chosen specifically for the interpersonal relationship of the advanced practice nurse and to cultivate a successful treatment relationship. Advanced practice nurses have the same ethical obligations as a physician in a treatment relationship, and a patient must trust their provider has their best interests at heart. So establishing a trusting, collaborative relationship with the patient can help them seek assistance for overuse or misuse of opioids. There is a significant societal stigma and bias even within the healthcare arena, and many patients report feeling shamed or labeled negatively, which prevents them from seeking treatment in the future. Approaching patients to discuss the areas that are important to them, such as, things that could be impacted more positively with being sober, can show improvement in the quality of life with things like health, personal relationships, economic impact, such as finding gainful employment or retaining the employment that they already have, their finances, and their future goals, such as going to school or getting a promotion in their job or getting married within their personal relationships, things like that. This lets the patient know that the advanced practice provider is looking at more than just taking away their substance of choice without any future rewards that may come from the work of getting sober for the patient. This is how the CSP is related to Peplau's theory, and it also looks at changing the health behaviors of addiction, the settings that the changes take place in, and improving the social circumstances for the patient in the future. It could also target in assisting the reduction of overdoses related to opioid use and the economic impact of patients relapsing or having comorbid health issues related to drug use, such as hepatitis C or other infectious diseases. Thank you for your time, and these are my references. Thank you for listening.